Welcome everyone. My name is Sara. Today I am going to discuss the case of ovarian and uterine leiomyosarcoma in an 11-year-old dog. Moving further, we came to know that female reproductive tract neoplasms are an uncommon finding in small animal medicine. Commonly reported reproductive tract neoplasms include ovarian carcinoma, GTCT, and uterine tumors. Oviductal leiomyosarcoma are rare. Uterine leiomyosarcoma are also uncommon. This is the only known case report of oviductal leiomyosarcoma in dog and only report of uterine leiomyosarcoma in addition to oviductal leiomyosarcoma as well. On case presentation, 11-year-old intact female was presented to emergency service with lethargy of 18-hour duration, anorexia, reluctant to move, and single episode of inappropriate urination in house. Drinking and defecating less than normal, history of intermittent leaking of her perineal region and straining to defecate, which was treated with addition of pumpkin to her diet. On physical exam, dog appeared quite alert and responsive. She was febrile with normal heart and respiratory rate. 1 millimeter inactive circular scar was noted on right corneal surface. Patient had mild diffuse muscle atrophy. Vaginal exams were not performed on lab and ultrasound findings. We came to know that a mass of mixed echogenicity was identified in proximity of left ovary. Red blood cell count, hemoglobin, and hematocrit was mildly decreased, likely reflected anemia of chronic inflammatory disease. White blood cell count was mildly increased, suggestive of an inflammatory response. On serum chemistry, there was mild hypoglycemia, increased blood urea nitrogen, hypocalcemia. These changes were likely related to anorexia, mild dehydration, urinary disease, azotemia. On urine analysis, findings were consistent with bacterial cystitis. Treatment with clavamox was initiated to treat urinary tract infection. It was suspected that large mass visualized on ultrasound was suggestive of reproductive tumor or cystic structure, but abdominal exploratory surgery was needed to confirm it. Patient was scheduled for OVH and exploratory surgery 2 days later. On the day of surgery, the patient was bright, alert, and responsive, and her vital parameters are within normal limits. In addition to previous findings, patient had clitoral hyperplasia as well as 0.5 cm dermal nodule on right side of labia. The nodule did not extend into vulva. Abdominal laparotomy performed via ventral midline incision. Both ovaries itself appeared grossly normal. A 3 cm round mass was visualized near cranial aspect of left uterine horn. A 5 mm mass was identified near cranial region of right uterine horn. No abnormality in uterine body was identified. OVH was performed with the masses being completely excised. Brief abdominal exploratory laparotomy was performed and no abnormalities were appreciated. On histopathology, masses were comprised of spindle-shaped cells with eosinophilic cytoplasm, indistinct cellular borders, and abundant eosinophilic matrix. Histochemical staining using Mason's tricone demonstrated sheets of smooth muscle cells surrounded by stroma mesenchymal cells. These characteristics are consistent with grade 1 oviductal and uterine leiomyosarcoma, a malignant neoplasm of smooth muscle tissue in oviduct and uterus. Small circular ovarian mass was incidentally found on histopathology that was not grossly observed. Consists of polygonal cells with eosinophilic cytoplasm, indistinct cellular borders arranged in papillary structures. This mass was consistent with an ovarian papillary adenoma. Uterus was affected by cystic endometrial hyperplasia, characterized by cellular debris and neutrophils infiltrating the lumen of the cell. These were the images which was taken during histopathology. On follow-up examination, dog was reported to be in good condition. Further staging 1 month from procedure was offered in the event of local metastasis but was not pursued by dog owners. 8 months post-surgery, no follow-up appointments have been performed. The patient was lost to follow-up for telecommunication. Leiomyosarcoma is a malignant neoplasm of smooth muscle tissue. No specific breed of dog or cat has been described to be at an increased risk of reproductive leiomyosarcoma. Common clinical signs of patients with leiomyosarcoma depend on the site of neoplasm. In our case, patient presented with tenesmus, stranguria secondary to bacterial cystitis and dehydration. GIT leiomyosarcoma causes hypoglycemia secondary to another disease process. Only way to diagnose a reproductive neoplasm is to sample tumor with fine needle aspirate, obtain an incision biopsy or perform epithelial tumors are the most common subtype in dogs. In this case, benign papillary adenoma was incidentally resected with the affected ovary. Most epithelial tumors were bilateral, but in our case it was unilateral. It is reported that epithelial ovarian tumors are unlikely to produce sex hormones as compared to other types of neoplasia. The patient in this report had clitoral hyperplasia related to hormone production by benign ovarian lesion and due to age-related changes. This case highlights rare but successful diagnosis and treatment of these neoplasms. Thanks to all for listening.